Are you trying to figure out if you're infertile? I'm Dr. Rahi Victory, an infertility specialist, and today we're going to share with you easy ways to determine if you're actually struggling with infertility. So the most important determinant is whether or not a woman's periods are regular. So if you have periods every 21 to 35 days, the likelihood is very high that you are ovulating. You can easily check at home with an ovulation predictor kit or see a specialist who can monitor your LH levels or monitor with ultrasound to make sure you are growing and releasing an egg. If you are growing and releasing eggs on a regular basis, then if you are under the age of 35, it can take a fair bit of time in order to get pregnant. So you can wait up to a year with regular unprotected intercourse. What's regular? At least 2 to 3 times per week, all through the month. If you are between 35 to 40, you should probably be trying to see a fertility specialist if you have not had success after 6 months. And if you're over 40, the current recommendation is that you see someone after 3 months because time is of the essence, and you could be running out of opportunity if your ovaries are getting weaker. From the male perspective, it's actually really difficult to know if you have normal sperm or not. Now, there are home kits you can use, and I've even seen apps for using it on your iPhone and your Google phone. I don't recommend any of those because we don't have validated studies to show that they work, but simple things that you can look at are health habits. Are you smoking, drinking, or using drugs? They're all going to significantly decrease your chances, as much as 80% in some cases. Are you morbidly obese or very heavy or have a very poor diet? That can have a significant impact. Does your job involve you sitting for a long time, or even, if you're exercising but you're bicycling? Those can all have very significant impacts. Truck drivers, cyclists have lower quality sperm and poorer sperm performance than other men do. So if you have risk factors, including erectile dysfunction, loss of libido, loss of sex drive, hair loss, if weight gain is an issue for you, you have a poor diet, you're very stressed, you're exposed to heat, or you are exposed to pressure in your groin, those are all markers that something could be wrong, and it's probably reasonable to get investigated, especially if you're having a problem. Now, in regards to the patients that are not having regular periods, going back to the women again, if you are not having regular periods, you need to see a doctor for 2 very important reasons. 1, it's extremely unlikely you're going to get pregnant on your own. And 2, it can be a risk factor for developing endometrial cancer, which is cancer of the lining of your uterus. So having irregular cycles does increase ongoing estrogen exposure, and that ongoing exposure can result in you having an abnormality of your lining, which can be precancerous or cancerous. So please get that checked out.